Good morning, everyone. Myself, Dr. Sunal Garg, and I am working as consultant diabetologist and metabolic disease expert at Twin City, Yamunanagar. I did my MBBS and MD from Government Medical College, Amritsar, and I did my DM from Liverpool University, London.
How does Imeglimin fit into your regular practice with the current landscape of E2DM treatment option? Kindly share your experience.
Imeglimin is a new revolution in the treatment of diabetes, and it has given me very immense results in the treatment of diabetes, specifically for those patients who are on a very high possible doses of oral hypoglycemics and still are not under control. Its mode of action is totally different. It acts on the mitochondrial function, and it controls the dysfunction of the mitochondria, and it helps in increasing the sensitivity of the insulin and decreasing its resistance. It also leads to increase in the beta cell mass by decreasing its apoptosis due to the decreased generation of reactive oxygen species. Hence, increases the lifespan of the beta cells and thus increasing the secretion and thus decreasing the exhaustion of the beta cells, which is being generated by the previously introduced oral hypoglycemic drugs. That is, it also helps in reducing the doses of the initial oral hypoglycemic drugs and even the insulin on which the patient is. It has got a very low side effect profile, specifically for GI intolerance, and but do have some little bit of side effects in the form of allergic manifestations, and should be introduced to a patient with a care that he or she might not be suffering from some allergic manifestations prior to the start of the medicine. Few of my patients have also shown one of a GI complication, which is loose motions, but not all. As per my data, in approximately 6,000 patients, only 6 to 7 patients have shown me this GI side effect. A single patient has shown a manifestation of allergy, but rest have shown very good results in the form of decrease in the doses of the other oral hypoglycemic drugs, and even the stoppage of insulin therapy to the patients who were on insulin previously.
In what specific patient populations do you see the greatest benefits of using Imeglimin?
Now, there is not any specific population for this. But this drug is not to be given in those patients who are suffering from chronic kidney disease with eGFR of less than 45, chronic liver impairment, pancreatitis, type 1 diabetic patients. This drug is contraindicatory in these people. Even this drug is not to be given in those patients who have a continuous nasopharyngitis or allergic rhinitis, because this can provoke these symptomatologies. I usually start this drug to newly diagnosed type 2 diabetic patients, because I have previously explained that this drug increases the beta cell mass, and we know that diabetes represents itself only when there is more than 85% reduction in the percentage of beta cells in the pancreas. So if we increase the mass of the beta cells, we can even try to remit the diabetes from a newly diagnosed type 2 diabetic patient. Also, this drug can be given to the patients who have undergone atherosclerotic cardiovascular disease phenomena, because it not only improves the glucose levels, but it also increases the delivery of oxygen to the cardiac muscles, which is required for their functioning. I think no specific population is to be taken into consideration, but yes, this drug can be used to any person apart from the contraindications which I have mentioned prior.
How does Imeglimin compare to other hypoglycemic agents in terms of safety and efficacy? We can share a real world case if need.
In one of the journals, I read that Imeglimin is a intelligent drug. Now, why it is an intelligent drug? That article specifically mentioned that this drug does not lead to hypoglycemia. Rather, it stops its action when the glucose levels are below 120 milligram per deciliter and starts again. It can only lead to hypoglycemia because it increases the propensity and action of the other oral hypoglycemic drugs when given in collaboration with this drug. So, it is a very safe drug until unless given to a contraindicatory patient.
In recent time, Imeglimin sustained release formulation with Indian study has been launched in India. What is your opinion on that?
In Indian scenario, adherence to the medical therapy is a great challenge. Most of the patients, they do not see the benefits of the medicine, but they see the dose of the medicine, that it is 1000 milligram, it is a very high dose, because they compare these drugs with the dosage of antibiotics. So, Imeglimin 1000 milligram sustained release is far much better than giving Imeglimin 1000 milligram twice a day, which is not a sustained release, because this will give a psychological effect to the patient that he or she is taking a less dose as compared to the other patients who are taking 2000 milligram per day, and I am still on 1000 milligram per day. If the dose is totally adherent, so the compliance makes better efficacy in the treatment of diabetes rather than non-compliance. So sustained release has given me a better compliance than the twice a daily regime. Also, cost cutting, it is pocket friendly.
How does mitochondrial targeting mechanism of Imeglimin influences its clinical use?
Now, we know that mitochondria is required for oxidative phosphorylation. And during oxidative phosphorylation, it also leads to the generation of reactive oxygen species. Now, in hyperglycemic states, there is increase in the substrate. So there is reversal of the shunt. And hence, there is increase in the generation of reactive oxygen species, which leads to oxidative stress and destruction of the beta cells. Now, Imeglimin, it improves the mitochondrial dysfunction by increasing the sensitivity and the secretion of the insulin, which leads to decrease in the supply of substrates to the mitochondria for oxidative phosphorylation. Hence, decreases the reactive oxygen species generation and hence decreases the beta cell destruction because of the oxidative stress. Because of decrease in the beta cell apoptosis and increase in the beta cell mass, there is increase in the insulin secretion, there is decrease in the insulin resistance, and hence there is decrease in the hepatic gluconeogenesis. Hence, thus leads to control in the fasting glucose levels as well as the postprandial glucose levels, thus maintaining the glucose levels in the normal state and hence preventing the complications related to hyperglycemias. And it is a weight neutral drug, so does not lead to weight gain, but I'm not sure, but and no study has been done about the reduction in the weight, but it is quite been referred in various journals that inflammation is a weight gaining portfolio for any patient. So if it is decreasing the inflammation, then it might not lead to weight gain, rather it can lead to weight reduction. But still, I am on this. Let us see what comes in the later scenario.
What are the key safety and efficacy findings from clinical evidences on Imeglimin that clinicians should be aware of?
I have already told that this drug is quite safe, but should not be given in a little bit of contraindications there, like type 1 diabetes, the patients who are having chronic kidney disease as well as chronic liver disease, and the patients who have got a history of nasopharyngitis or tonsillitis. These patients are not to be given such type of drugs. And pancreatitis has not been labeled as a contraindication, but still, in a matter of fact, I do not recommend this drug in a pancreatitis patient also. And otherwise, the drug is very much safe and helps in reduction of the various other oral hypoglycemic dosages, thus increasing the cost effectiveness and drug adherence of the patient, and increasing the quality of life, and thus preventing the weight gain and other complications of the uncontrolled diabetes.
Do you believe that Imeglimin has the potential to change the future landscape of diabetes treatment?
Definitely. I call this drug as a wonder drug. I also call this as an oral insulin. This is a very, very remarkable drug, and everyone should try this drug on their patients apart from the contraindications I have labeled. I think that this drug has been launched in a single, it has not been launched in a combination scenario. But if this drug is being combined with glimiprides, or being combined with DPP4 inhibitors, or being combined with SGLT2 inhibitors, or is being combined with alpha glucosidase inhibitors, or any other oral hypoglycemic drugs in a fixed dose combination, this will give a remarkable results in the treatment of diabetes, and also it decreases the progression of the diabetes from one stage to the other stage, and from the second stage to the third stage. That is from risk factors of patient getting into pre-diabetes from the normoglycemic stage, and from pre-diabetes to the diabetes. So I think yes, this drug is coming out to be a boom in the treatment of diabetes in the near future, and I am seeing it. My patients are very much satisfied with this drug, apart from a few who showed some of the side effects of this drug.
Apart from this, if any special note or any message you would like to share?
The drugs has to be given taking into consideration their side effect profile and their effect profile both, and should be kept on in a balanced form.